This is the second video in my 9-part educational series about gentle touch vasectomy. Vasectomy offers benefits for both women and men. Women benefit from vasectomy because their partners share in the responsibility of preventing pregnancy. Women bear all the risk of pregnancy and all the risk of using hormonal birth control. Unfortunately, women also shoulder most of the responsibility for having to be the ones to have permanent birth control. Vasectomy allows men to contribute to reproductive planning. Vasectomy allows women to avoid the risk of hormonal birth control. Vasectomy allows women to avoid unplanned pregnancy, abortion, and the risk of carrying a pregnancy to term. Since most pregnancies result in good outcomes, we mistakenly assume pregnancy is without risk. Pregnancy does have risk, and about 1 out of every 10,000 pregnancies can result in the death of the mother. In the developing world, this number is much higher. Vasectomy allows women to avoid tubal ligation. Tubal ligation is a surgical procedure performed in the operating room using general anesthesia. Tubal ligation fails more frequently than vasectomy, and tubal ligation failure often results in ectopic pregnancy, a serious condition in which the pregnancy develops in the fallopian tube. Vasectomy is much safer for men than tubal ligation is for women. There is only one reason to have a vasectomy: to prevent pregnancy. Although men have vasectomy for this single reason, men have many different motivations for having a vasectomy. Vasectomy allows men control over their reproduction. They do not have to rely on their partner to take birth control or worry about the possibility of contraceptive failure. For many of my patients, vasectomy allows them to limit the size of their family, and this allows them to be better providers for their children and their spouse. For others, having a vasectomy saves their partner from using hormonal birth control or from having a more risky tubal ligation procedure. Many of my patients have vasectomy because they don't want to ever have a child. Some men see vasectomy as a personal way to contribute towards the health of our planet by limiting overpopulation, consumption of natural resources, and changes in climate. If not having children or limiting overpopulation are difficult reasons to have a vasectomy for you to understand, then you have never visited an overpopulated country in the developing world. Most well-done studies show no significant long-term side effects from having a vasectomy. You may be surprised, many studies show an improvement in sexual satisfaction after vasectomy. This improvement in sexual satisfaction is experienced by both men and women, and this improvement is because vasectomy provides you freedom from fear of an unplanned pregnancy. Vasectomy has benefits for both men and women and is the safest and most effective form of permanent birth control.